The Causes and Effects of Sports Injuries by Claire S. Injury is such a big deal? Just ask the athletes. They'll tell you all about the risks involved in sport. They'll say that if someone gets hurt, it reinforces the fact that sometimes they train at the risk of permanent injury, surgery, or worse. That's why sometimes people are scared to do something that they are required to do in that area, and that could lead to more injuries. But in gymnastics, the competitors are used to these. Why? For one thing, gymnasts go to practice at least 2 or 3 times a week, so that means that they have to use their muscles for hours. But what happens when you use a part of your body for too long? It hurts. A lot. These are called overuse injuries. These injuries occur when an athlete uses a muscle or ligament too much. This means that they may have to sit out of practice and they will fall behind their teammates. Overuse or repetitive movements may be the #1 cause of sports injuries. Runners, swimmers, and tennis players are particularly susceptible to overuse injuries, including tennis elbow, tendinitis, shin splints, and shoulder impingement, says Livestrong.com. As you can see, athletes who work out a lot have to try and deal with these injuries, but there are many more injuries that can come from overuse. But is there a certain age group that has the highest amount of injuries each year? Actually, yes, there is. Children are most at risk of developing an overuse injury. This is because their bodies are still growing, which can make their bones, muscles, and joints unstable and more vulnerable to damage, says NHS Choices. But that doesn't mean that kids shouldn't do sports. Because they're growing physically, they're also growing mentally. And kids need these teamwork skills for the future when they need to work with someone else, possibly from around the world. How do you classify one of these injuries? Sometimes it can be really difficult because the athlete might suffer more than one injury, and there are lots of possibilities can be considered. Traumatic injuries can include a contusion or bruise, which is a damage to small blood vessels which causes bleeding within the tissues, a strain, a trauma to a muscle due to overstretching and tearing of the muscle fibers, a sprain, an injury to a joint caused by the ligament being stretched beyond its own capacity, a wound, an abrasion or puncture of the skin, a bone fracture, a head injury, or spinal cord injury. In sports medicine, a catastrophic injury is defined as a severe trauma to the human head, spine, or brain, says Wikipedia. This is important because if someone classifies your injury wrong, it can either only get a little better, it might stay the same, or maybe it might get worse. Sure, there are physical effects from the injuries, but there are mental effects as well, and these might even be more restraining than the actual injury. All in all, sports injuries have innumerable effects on individual athletes, teams, and fans worldwide. Injuries are all part of the world of sports and must be anticipated before every game, no matter what sport is concerned, says LowQuitter.com. This is important because it shows how even if it's a small one, any sports injury should be taken very seriously. I think that these reasons might clear up some things that people might not understand about sport injuries. But you can never really understand the circumstances of this area unless you're an athlete yourself. I predict that in the future, sports injuries will be on the rise and people in other sports might get as comfortable as gymnasts are with injuries, which isn't necessarily the best thing.